Everybody, welcome back to Advanced Health Wellness Center. I'm Dr. Buck.
I'm Leah Klein.
And so we wanted to talk today about non-surgical solutions to knee pain that are actually covered by insurance. So the truth is those things do exist, and they do work for a great majority of people. There's lots of things that can be done on top of it, but we'll interview the expert. So Leah is a specialist in non-surgical orthopedics. She's the person that evaluates our patients and does these treatment plans with them. She's awesome. She's done it now probably thousands of times, and so we'll ask the expert. So first question, are there non-surgical options to help you with knee pain?
Yes, there are.
And what would you say are, what's your first kind of line of, yeah.
The hyaluronic acid we've talked about before, so if you've tuned in previously, you've probably heard us talk about it, but it's a gel, it's a lubrication, done in a series of injections, and your insurance does cover that
FDA
as an
approved
option.
and covered. And there's different ones based on insurance. There's certain ones that we feel like work better than others. So you may have had this done before, but it may be the type of hyaluronic acid solution that was done that can have an impact also. Does everyone qualify for that?
No, not everybody qualifies. It's something that you have to have had previous failed attempts at relief, say with physical therapy or previous types of injections. There are qualifications that need to be met still.
And what about every joint?
It's not for every joint, it's just for the knees.
And what about every knee joint?
It's not for every knee joint, it has to be an arthritic knee joint.
So, or sometimes it can be past the point of helping too.
Yeah.
So the point is, you need to be evaluated, right?
Definitely.
Does insurance cover that?
The evaluation?
Yes.
Exam and x-ray?
Yeah, so guys, if you've heard us talk before, we're trying to be able to transition some of these things where your insurance does help with some of the costs on these treatments that do, and the other thing about that, it does reduce inflammation, it improves lubrication, so then it even sets the person up for better results with regenerative medicine in the future, is that right?
Definitely.
And then what's the other thing? How about bracing?
Bracing is covered by insurance as well, so we have to evaluate you again to see if you qualify for a brace, particularly one that unloads the weight of your body onto the arthritic part of your knee. So we help to kind of offset that balance and help you be able to walk and hike and do work without pain.
So that's something that I wanted to mention. People are not getting to enjoy time with their family. They're missing out on going on a walk maybe with their dog, or sometimes they say, it becomes this vicious cycle, right? You don't exercise and then you end up gaining weight, and then you need to lose the weight, so you need to exercise, but you can't because you have too much pain, and the more weight you gain, the more pain you have, the less mobile you're able to be. And so somebody needs to step in there and make a change and a difference, because your family depends on it. Your future depends on it, what you're able to do, again, later on in life. I mean, we have to take care of this body. It's like we have this finely tuned, highly functioning machine, which is our body, but it needs maintenance, like when mechanics are greasing or putting the lubrication on the joints in a motor or in an engine or even a piece of equipment. It's the same thing. This is the same concept, and then the bracing is trying to keep things in an appropriate position. So again, there are options. Does every physician that somebody would see recommend these things?
No, they don't, unfortunately.
And there's no good, I'm just going to cut to the chase, like there's no good explanation as to why they don't. It's FDA approved, it's covered by insurance. Many physicians are still doing cortisone or prescription medication or surgery, and that's it. Maybe physical therapy, but physical therapy is somewhat limited by itself when you have arthritis. So just because it hasn't been recommended doesn't mean it doesn't work, and doesn't mean that it's not covered by insurance. So hopefully this will help somebody. Send it to someone you love. Send it to somebody that is not able to enjoy life because of pain. Help them to know that there are solutions. If you'd like to come in and get evaluated, again, Insurance covers the exam and x-ray. The evaluation for us is free. All you got to do is click the link below, and we'll get you in and find out if we can help.
Yeah, sounds good.
Have a great week.
Bye, guys.